Hello, the assessment that we will be researching is the Myers-Briggs Type Indicator by Gabrielle Greenwald and Laura Johnson.
The Myers-Briggs Type Indicator was developed by Catherine Cook Briggs and her daughter Isabel Briggs Myers. Catherine became especially intrigued by the idea of temperament after meeting her daughter's husband and observing how he saw the world in a different way. Briggs and Myers were heavily influenced by Carl Jung's concepts of temperament in his work Phonological Types. The MBTI was first published in 1943 as a paper and pencil exam.
The Myers-Briggs Type Indicator has a lot of different uses, and it's often used in schools, businesses, career counseling, family counseling, individual counseling, and couples counseling to help people understand and have more awareness of their communication styles and understanding of how they view the world. It's important to understand that it should not be used as a more formal assessment and is simply a tool to help one gain awareness and understanding of their personality.
While there were numerous research studies addressing multiple forms of reliability and validity, in this presentation I will discuss the three areas which were most prevalent in my research: test-retest reliability, split-half reliability, and construct validity. The test-retest reliability data was the most difficult aspect of the MBTI to assess because varying articles presented the results of this test in different lights. Several studies were conducted of the MBTI in which individuals were tested for a second time after a number of weeks. In multiple cases, between 35% and 50% of participants received different type profiles on at least one of the 4 temperament scales. Form G, a shortened 50-item version of the MBTI, was characteristically found unreliable in multiple test-retest studies. While some studies presented the test-retest reliability in a negative light, others attempted to use the results to show that the MBTI is in fact reliable. In a 1966 study of 94 teachers, 61% received an identical type profile 6 years later. 2 studies conducted in 1977 revealed test-retest coefficients ranging from 0.56 to 0.89, and another from 0.69 to 0.83. It is my understanding that coefficients of 0.8 or higher are considered to have good reliability. Coefficients between 0.7 and 0.8 are acceptable. Coefficients between 0.6 and 0.7 are questionable, and those between 0.5 to 0.6 are poor. The results of 0.89 in the study would indicate almost excellent reliability, but the results of 0.56 in contrast reveal quite poor reliability. While the article discussing these findings described their reliability as reasonably stable, it would appear that the test-retest reliability of the MBTI is inconsistent and at times questionable. Similar to the test-retest reliability, the results of the split-half reliability of the MBTI are mixed. While several studies of the MBTI have produced split-half reliability coefficients of 0.8 or higher, some of the results have still fallen in the questionable range. One factor that has lowered the split-half reliability coefficients in testing is the fact that the MBTI utilizes dichotomous categories rather than continuous scores to interpret results. For example, someone who takes the MBTI might only have scored 51% as a thinker and 49% as a feeler. The MBTI does not consider thinking and feeling as a range, but rather as 2 separate and distinct categories. You are either one or the other. The author suggested that this fact causes the loss of information, thus lowering the reliability scores. Construct validity is meant to show if the MBTI measures the traits it proposes to measure. A factor analysis of the MBTI revealed findings that question the construct validity of the MBTI. A 1985 study reported findings that the factors are not consistent with the MBTI scales. Several other studies have been done to attempt to correlate factors assessed by the MBTI with similar factors assessed by other tests. Many studies have found a correlation between extroversion on the MBTI and other personality tests. Another study found correlations between the sensing and intuitive scales and other tests measuring similar traits and behaviors. However, it appears that outside of extroversion and introversion, few of the other traits have been highly validated.
The Myers-Briggs type indicator is best used in a non-psychiatric population setting, as well as for people over the age of 14 years old. It's beneficial to those that are working on their self-awareness and are hoping to have a better understanding of communication styles and leadership styles and other different facets of their life and understanding how their personality relates to the world. While follow-up is not always necessary with the Myers-Briggs type indicator, because it's not assessing safety or psychological issues, it's just providing awareness to the client about their personality, it might be beneficial to follow up in either like an individual setting or a family or couple setting, just to help talk about how different personalities interact and how one can use that knowledge and increased self-awareness to better communicate in the future. It could also be used in a career counseling setting and by follow-up just to kind of help the client to, over time, become more aware at honing their skills and increasing that. And for a business setting, probably doing a similar thing and maybe following up with a program after they've utilized the MBTI assessment, and from there seeing the impact and changes that it's made, and what other things could change from that and what other growth areas are possible. It's not, follow-up is not necessary for like assessing for safety as in a client who's suicidal. But if stuff does come up from the deeper conversation, it'd be important to assess that. It's always important to make sure that one is looking at the safety pieces of that.
The MBTI has a number of excellent strengths and potential uses, as well as weaknesses. The MBTI is an extremely popular assessment that is used by counselors, individuals, and businesses. The MBTI is especially useful for explaining patterns of behavior in an understandable way. Because of this, it has many applications in the workplace. The MBTI is often used to identify leadership styles, promote team building, teach others to work together more effectively, and resolve conflicts. A few weaknesses of the MBTI are that it does not give an indication of an individual's motives or values. It does not measure how well each of the types or the opposite type is performed, and as a result, it may unfairly stereotype people.
Jung's theory of personality included 3 dichotomous types used in the Myers-Briggs type indicator: introverted versus extroverted, sensing versus intuition, feeling versus thinking. And then when Myers and Briggs were creating the MBTI, they added judging and perceiving to give a more full picture of people's personality types. It's important to learn and understand these, and that while they're important, a person is not solely introverted. They also have extroverted tendencies, and a person is not solely, sensing or feeling or judging. They have both components in their life, and it's important to understand that the Myers-Briggs type indicator gives a picture, but not necessarily, it's not necessarily saying that you don't have those other qualities. It's just saying that the preferences are your 4 types. So Laura and myself split up the presentation. I found that one of the more confusing pieces was follow-up reporting, as it's not incredibly necessary for the Myers-Briggs. However, I did find that it was helpful just to incorporate some pieces of understanding how to relate in like a counseling session with family members or couples counseling, or even in a workplace environment. And the one part that Laura found confusing was the reliability and validity. It's difficult to understand how the numbers compute to real life, and connecting stats in the real world are difficult to explain. So we did learn quite a bit about the Myers-Briggs, and it's only using with appropriate populations, ensuring that there's safety around that, for clients, especially for clients with psychiatric backgrounds. It wouldn't be a wise tool to use with them. And also that the MBTI aligns with Gestalt and person-centered theories by providing a deeper sense of awareness. And the validity and reliability of the MBTI is questionable and fairly inconsistent, even though it has definite value to people that use it. So.
Thank you for taking the time to watch this video. We hope you enjoyed our presentation.